use ice, a lot of ice, elevate your penis and scrotum, and using a scrotal support also helps significantly. The two main things you can do as a patient to reduce swelling, one is using ice. I'm a big advocate of using ice, but the other, and maybe even more importantly, is to elevate your penis and scrotum after the procedure. While you're up and about using a scrotal support, while you're sitting or laying down, rolling a towel and putting it under your scrotum to keep it up in the air and avoid, swelling due to gravity makes a huge night and day difference in how much swelling you get after the procedure. For the incision site, there's only a couple things I usually recommend. So one is you want to try to keep it clean, obviously. So after the first couple days, you can wash it with soap and water. Using hydrogen peroxide on a Q-tip and just rolling it and removing some of the scabs over the incision helps significantly, and putting Neosporin over the incision helps significantly as well. Sometimes the pump for the penile prosthesis rides a little bit high, and we'll have you place gentle traction on the pump to get it lower into the scrotum. Usually, you can feel it after about 2 weeks, and we'll start having you just apply gentle traction to the pump. Most of the time, you don't need to do that, however. Constipation after any type of surgery is a problem, and it happens because of pain medication and anesthesia. It's somewhat difficult to avoid completely, but prune juice does work very well. All types of fruit juices help. Stool softeners, which we can prescribe from the office, will help as well. Milk of magnesia also helps significantly. If it's really bad, we can prescribe you some citrate of magnesium, and that basically will unblock any drain. After penile implant surgery, I generally don't want you lifting more than 5 or 10 pounds for the first 3 to 4 weeks minimum. Bathing, I don't want you to shower for the first 48 hours. I really prefer you stay out of the bathtub. Prefer you stay out of the swimming pool as well. I don't want you to drive for at least 24 hours. And if you are driving for the first week or 10 days, I want you to really take it easy. Just drive on short trips. Don't do anything too strenuous or drive a long distance. So driving, technically, you could drive within 24 hours, but I wouldn't recommend driving until you're completely off of your pain medication. Work is an individual type of thing. If you're lifting very heavy at work, like say you're a UPS driver or something like that where you're lifting heavy boxes, you probably don't want to go back to work for 3 to 4 weeks. If you have a desk job, technically you could go back within a couple of days. The typical recovery period for a penile implant procedure, when you're talking about the incision completely healing, you being able to pump the prosthesis up and down and have sex, it's about a month. So typically after a penile implant surgery, if you have any questions or problems, I typically want you to call me right away. I'd much rather have you call me than not call me, even if it turns out to be a nothing. That being said, fever greater than 101 degrees Fahrenheit, pus draining from the incision, or you have a lot of bleeding within the scrotum and it looks like a big swollen, like an eggplant, call me right away. Generally, after the surgery, we're going to have 3 appointments. The first one is the day after the procedure. I'll usually have you come in, and all we're going to do is take the dressing off and take the drain out. Next one is at 10 days, we're going to remove the sutures. And the next one's usually at about 3 to 4 weeks. We're going to start trying to pump the prosthesis up and down and begin what's called cycling the prosthesis. Typically, you can use a penile implant within 3 to 4 weeks of the procedure. That being said, the incision has to be completely healed and you have to be comfortable pumping the implant up and down by yourself at that time. you have any questions during the recovery whatsoever, call our office. My staff is very well read. They'll get a hold of me right away, and we can discuss any problems or questions that you have at that time.